Welcome to The Explainer. Today, we're digging into a huge new study about a medication that's probably in millions of medicine cabinets around the world, Omeprazole. And what these researchers found, well, it might just surprise you. But let me start with a quick question, especially for the millions of you who take something for heartburn or acid reflux. How much do you really know about the long-term effects of that little pill you rely on? So we're talking about Omeprazole, which you probably know by its brand name, PLoS. It's a type of drug called a proton pump inhibitor, or PPI. And, for decades, it's been the absolute go-to, first-line treatment for all sorts of acid-related problems. It's a drug millions of us trust to be both safe and effective. But that whole idea of its safety is now facing a pretty serious challenge. A brand new, large-scale analysis of real-world patient data has uncovered this powerful statistical link between omeprazole and some really serious side effects. Side effects that, and this is the key part, are not currently listed on the drug's warning label. So you might be wondering, how in the world did researchers suddenly discover these risks in a drug that's been on the market for so long? Well, it's because they didn't run a typical clinical trial. Nope. Instead, they went on a hunt for clues in a place where millions of patient stories are already collected. And that place is the FDA's Adverse Event Reporting System, or FAERS for short. You can think of it like a giant public library, just packed with millions of side effect reports that have been sent in over the years by real patients, their doctors, and other health professionals. It's an absolute goldmine of real-world data. Their process was basically digital detective work. First, they pulled every single report that mentioned omeprazole over a 20-year span. Then, they had to clean up the data, get rid of any duplicates to make sure it was accurate. Step 3 was the big one. They analyzed it to find side effects that were popping up way more often than you'd expect just by chance. And finally, just to be extra sure, they double and triple-checked any signals they found using 4 different statistical methods. And what they were looking for is something called an adverse event signal. Now, a signal is not 100% proof that the drug caused the problem. Think of it more like a detective who notices the same guy's fingerprints at 15 different crime scenes. It's not a conviction, but it's a huge clue that something is definitely going on, and it warrants a much closer investigation. So after all that digging, what did this massive trawl through 2 decades of data actually turn up? The results were pretty eye-opening, to say the least. First, let's just talk about the sheer scale of this. We're not talking about a small study here. The researchers combed through more than 119,000 individual reports connected to omeprazole. I mean, that is just a staggering amount of real-world patient experience. And here's something that's really interesting. Who was actually filing these reports? You might think it'd be mostly doctors, right? But nope. The single biggest group, at over 40%, was consumers. Just regular, everyday people who noticed something wasn't right and took the time to report it. And this wasn't some fluke or a one-time thing. The number of reports has been substantial for years. We saw a big peak back in 2012, and the highest number of reports in a single year was actually just in 2019. So this is a very current and ongoing pattern. The data also showed, pretty unsurprisingly, what people were using the drug for. The top reasons were all the usual suspects: GERD, dyspepsia, ulcers, and so on. So no surprises there. But the real shockers were buried elsewhere in the data. Because when the researchers started sorting through those 119,000 reports, one particular category of side effects lit up like a billboard in Times Square. The signal was so strong it just dwarfed everything else. And here it is. This is the big one. When they grouped the reports by body system, renal and urinary disorders, we're talking kidney problems, had a signal strength of over 15. Now look at the others for comparison. Endocrine at 2.8, gastrointestinal at 2. I mean, nothing else even came close. It was the only category that met all 4 of their strict statistical criteria. The study actually visualized all this in a chart, and it makes the connection to kidney-related issues just incredibly, incredibly clear. Okay, now let's drill down into that kidney category, because these numbers are just wow. The statistical signal linking the drug to chronic kidney disease was more than 87 times higher than you'd expect. For acute kidney injury, over 18 times higher. And for end-stage renal disease, that's the most severe outcome, the signal was a mind-blowing 123 times higher than expected.
And this right here really gets to the heart of the problem. The drug's official label does mention one very specific, rare type of kidney inflammation. But the biggest, most severe problems that showed up in this massive data analysis, things like chronic kidney disease, renal failure, and end-stage renal disease, they're just not there. They're missing from the label.
So, what does this all mean for the average person taking this pill? What's the real takeaway from all this new information?
Okay, first and foremost, and this is so important to remember, this kind of study shows a very powerful statistical link, a correlation. It doesn't prove that the drug caused the problem. But when you have a signal this strong across this much data, verified with this many methods, it is simply too loud to ignore.
And the kidney risk wasn't the only new thing they found. The analysis also flagged a few other potential issues not on the label, like certain endocrine problems and something called rebound acid hypersecretion, which is when your heartburn can actually get worse after you stop taking the drug. And interestingly, they also found a strong signal for intentional product misuse, which kind of suggests that because this stuff is so easy to get, people might be overusing it. Look, the whole point of this explainer is not to create panic. It's not to tell anyone they should immediately stop taking their medicine. Absolutely not. The real goal here is to empower you with the latest real-world data so you can be an active, informed partner in your own healthcare. Ultimately, what all this research really suggests is that for anyone taking omeprazole, especially if you've been on it for a long time, it might be time for a conversation. A conversation with your doctor to weigh the benefits against these potential new risks, and to just ask a simple question: is this still the right choice for me?